don't go believing anything I said. No, don't go believing me. No, don't listen to me, don't take any notice. Don't listen to anything that I say. Thank you.
Thank you, Mr. Speaker. With permission, I will make a statement on the government's plans for health and social care. Our National Health Service is the pride of our whole United Kingdom, and all the more so after it has been there for us during the worst pandemic in a century.
The funding's been hammered. 8 years of austerity, is it now? And you know, the fact that more people aren't dying is the one that gets me.
Treating almost 500,000 patients, administering more than 88 million vaccines, and saving countless lives.
A study published early this year in a respected European medical journal and authored by 4 leading medics and epidemiologists from California's top university, Stanford, aimed to look at the difference between case numbers among places that did really strict lockdowns and compare them to those that did far less restrictive measures. The study looked at data from 10 countries, including England, the US, Spain, Italy, Iran, and France, places where strict lockdowns were implemented, and they then compared it to places like South Korea and Sweden, 2 countries that did not implement mandatory stay-at-home and business closures, but merely made recommendations to their citizens. You know, treating adults in a free society like, well, adults in a free society. Finding number 1. Implementing any restrictions was associated with measurable reductions in case growth in 9 out of 10 of the countries, including South Korea and Sweden. No benefit of restrictions at all was found in Spain. But finding number 2 is the real biggie. There was no clear benefit of mandatory heavy restrictions over basic recommended ones.
But the inevitable consequence of this necessary and extraordinary action is that COVID has placed massive pressures on our NHS.
For now, the boss at Milton Keynes isn't planning to cancel routine operations this month, but that all depends on whether the surge in patients needing a bed continues.
The patients that are coming through our doors are frailer, they are more sick, and they are staying in our hospitals longer, and that's what's causing the pressure. If you combine that with some of the other factors like flu, like we haven't had any real downtime in the NHS, that's what's tipping us over at the moment.
Last year, the really intolerable pressure lessened after a couple of weeks. At this stage, it's impossible to tell if this year the health service will be as lucky.
As we stayed at home to protect the NHS, has not been achieved by the vaccination programme. That it's the lockdown that has been overwhelmingly important in delivering this improvement.
There was no clear benefit of mandatory heavy restrictions over basic recommended ones.
Thousands of people did not come forward for the treatment they needed.
A misleading answer to the House.
It's another cruel consequence of COVID. Routine operations and procedures were cancelled to clear hospital beds for coronavirus patients earlier this year.
Like those who suffered from COVID, these are all people we know. Your aunt, who needs a new hip.
Routine operations and procedures were cancelled to clear hospital beds for coronavirus.
Your neighbour, who has problems with their heart and needs a pacemaker.
Routine operations and procedures were cancelled to clear hospital beds for coronavirus.
Your friend at work who thinks that they should get that lump or cough checked out.
Routine operations and procedures were cancelled to clear hospital beds for coronavirus.
The huge impact that coronavirus is having on the NHS was made clear today as new figures revealed just how many people have now been waiting more than a year for routine hospital treatments and operations.
Routine operations and procedures were cancelled.
It's at its highest level in England for 12 years. By September, almost 140,000 people have been waiting more than a year for non-urgent operations like hip and knee replacements. Compare that to the month before the pandemic hit in February this year, when just over 1,600 people had been waiting that long.
There was no clear benefit of mandatory heavy restrictions over basic recommended ones.
When they arrive at Heartlands Hospital in Birmingham, there are 3 ambulances ahead of them waiting to have their patients accepted by the A&E. Last week, across England, more than 1 in 6 ambulance handovers like this were delayed by 30 minutes or more. This is what is stretching the system. Ambulances stuck, waiting to hand over patients to hospitals that are too busy to take them.
So we must now help the NHS to recover, to be able to provide this much needed care to our constituents and the people we love, and we must provide the funding to do so now.
Well, let's see about cutting some money from, I don't know, the MOD and the ARPA that they want to set up, with their 800 million. And we don't go into the whole human augmentation crap, because that's going to cost us a fucking fortune. We can cut all that out and save the money off that. You could also then cut the aid to China, because China set up its own IMF basically. It can support itself independent of the IMF. They've got enough money to do it. Why are we sending them aid? We could also cut the money for, I don't know, let's see, the Belt and Road Initiative. Instead of keep funding money into that, you can let this country that's got its own IMF fund its own Silk Road, as it used to be called. That could do for starters. Instead of taking it off us, after all the shit you've caused.
We not only have to pay for the operations and treatments that people decided not to have, that people decided not to have, that people decided not to have, that people decided not to have during the pandemic.
A misleading answer to the House.
Routine operations and procedures were cancelled.
We need to pay good wages for the 50,000 nurses who will enable that treatment and who can help us tackle waiting lists that could otherwise expand to 13 million over the next few years.
It's at its highest level in England for 12 years. By September, almost 140,000 people have been waiting more than a year for non-urgent operations.
And who can help us tackle waiting lists that could otherwise expand to 13 million over the next few years.
A simple bit of maths for you. Take a waiting list. Take the last, 4 years. Increasing people on that list. About 500,000 people. So why is it over the next few years it's going to triple? Think about it. I've told you what they're intending. So 13 million people waiting on lists for all sorts of different treatment, for all sorts of different ailments. And it's 3 times the size of the current waiting lists. How is that possible? I've even been shot 3 times yet. Shot 3 times. 3 times the number on the waiting list.
Well, we're joined now from Tamworth by Professor Helen Stokes-Lampard from the Royal College of GPs. So what the Health Secretary's calls for patients to stay away from A&E drive them back into the arms of GPs who are already massively too busy?
Well, that is an inevitable consequence, but the NHS is one whole structure. Primary care, secondary care, we work together for the good of patients. And for many patients, it may well be best that they're treated and sorted in general practice, in the community, by their pharmacies, by their practice nurses. But there are some patients that don't need treatment at all, and obviously those are the ones that the Secretary of State is trying to target and say, if you don't need to come in, please don't. If you can get treatment or help close to home, do. If you can get help from family and friends or from a local pharmacy, do. So it's think before you act in terms of accessing NHS services this winter.
Yeah, and I'm sure that, there are lots of people who reluctantly go to A&E because trying to get an appointment with your GP is a lot harder than it used to be.
We need to now to go beyond the record funding we have already provided, and we need to go further than the 48 hospitals and 50 million more GP appointments that are already in our plan.
Around 888,000 patients had checks for potential cancer between April and September, but that's down 27% on the same period last year. The number actually starting treatment was 121,900 between April and September. That's down 22%.
So today we are beginning the biggest catch-up programme in NHS history.
Did you get rid of austerity? No, you didn't. Your little bald gnome, your little right-hand man, didn't actually let it finish. Didn't finish, although he called it, didn't finish. So you haven't replaced the money that was supposed to be there since you made the cutbacks. Failure number one. So now you're saying you're spending more money on the NHS, more than ever before. Well, no, you're not, because you haven't even reached what the levels should be at by now. You haven't actually got rid of the austerity and replaced the money, so you're not putting any extra money in, you're just putting the money in that should be there in the first place. Error number two. Hospitals. We had, 1,900 and something, and they were cut by, 650 odd. You opened 223 places over COVID, and now you're saying you're building 14 more, 49 more, 48 more. Make your fucking mind up. Error number three. You're not opening any more up, you're only opening up old hospitals that you closed down. Where's all these extra beds from the Nightingale hospitals? Seeing as how you removed beds from hospitals because of COVID and social distancing. So where are all these beds? Where are all these beds you could literally fill places with? And do we get a return on the money because those beds were never used? If not, then who made a whole bunch of money on those beds and where are they? Because that's error, number three, number four. Just keep racking all these errors up. Every time you open your trap, you make errors. I mean, we've had a steady increase of 500,000 people every 3 or 4 years on the waiting lists. That's been relatively constant. It's been more constant than your bloody vaccine little slope. So why all of a sudden is it going to escalate to 13.5 million? So what's 13.5 million in the next few years? Yeah, you're falling right into line with the figures that Deagle put out. It's the whole depopulation, and you're letting this shit out. And we're noticing it, and we're pointing it out, and we're not going to give up until, you're going to cave in first. There ain't no cat in hell's chance. I am letting this go. Dog with a bone.
Tackling the COVID backlogs by increasing hospital capacity to 110% and enabling 9 million more appointments, scans and operations. As a result, while waiting lists will get worse before they get better, the NHS will aim to be treating around 30% more elective patients, around 30% more elective patients, around 30% more elective patients by 2024-2025 than before COVID. And we will also fix the long-term problems. Fix the long-term problems. Fix the long-term problems.
Long-term progress? Problems?
And the problem is not with the health systems, it's the numbers of sufferers.
Yeah, progress is net zero. Less carbon. Carbon-based life form, fewer of you by about 13.5 million over the next few years. So by 24-25, yeah, you're all fucking gone. Get used to it.
Of health and social care. Of health and social care that the party opposite certainly failed to tackle, Mr. Speaker, and that have been so cruelly exposed by COVID.
cruelly exposed by COVID. You keep opening your trap, you daft bastard.
Faster GP access to specialists, so you don't have to wait months to see someone in hospital to find out whether something is wrong.
Pay attention to this. They've been after this for years and years. In your own home.
And new digital technology so doctors can monitor patients remotely in their homes. Remotely in their homes. Remotely in their homes. And we will do all this in a way that is right and reasonable and fair.
So the data for your medical records? Well, it's all going through a QR code now. Well, they want to try and do that. But who actually has access to your medical records? Matt Hancock was asked about this after certain people were charged and they used medical records to track these people down, which they shouldn't have had access to. And when Matt Hancock was asked about it, his full explanation on, the whole implications of this, his answer was no.
And lead the global effort to secure a robust human suffering.
To 13 million over the next few years.
Inadvertently misleading the House, and secondly, outline what steps he intends to take to undo the damage.
Suggest inadvertently.
Inadvertently misled the House.